Questions? Yeah.
Hi. The numbers that we looked at show that Suffolk County is getting more of the vaccine, even adjusted for population, than other parts of the state. Can you talk about what's going on there?
Yeah, remember the rollout here for the vaccine initially was based on a commitment to, at least for the stuff that wasn't being driven directly by the feds that was going to long-term care facilities, was to provide doses to healthcare workers, and especially those who were COVID-facing workers. And that was point number one. Point number two was you needed to have the infrastructure to take and store and then use the Pfizer vaccine, which had very particular requirements with respect to sort of deep freeze, for lack of a better way to put it, and the Moderna vaccine, which required less deep freeze, but also had some particular requirements with respect to storage. If your ultimate objective at the beginning is to make sure you hit as many healthcare workers as you possibly can who are COVID-facing, you are going to end up distributing vaccine based on where your hospitals and your healthcare workers are located. And that means places like this, in this part of Massachusetts, and in Suffolk County there are 5 hospitals, including 4 academic medical centers. And about half the people who are currently hospitalized for COVID in Massachusetts are hospitalized in Suffolk County. It would not surprise me. That's the measure. It's not a per capita thing. It's a function more of the fact that there's a very significant hospital and healthcare infrastructure located in Suffolk County that has borne a big piece of the load associated with taking care of people since this began. As we move out into other categories, like first responders who start on Monday, obviously that will look more like a traditional distribution because of those 60 sites that will be available across Massachusetts for first responders to get vaccinated. And then when you move from there into some of the congregate care populations and the over 75 population, you're going to start to see something that looks, I think, more like what I would describe as kind of a general distribution, even though those will be targeted populations as well.
Do you have a time frame yet for moving down that priority list beyond the first responders?
We have what I would describe as a sequence, right? But how soon we hit the various elements of those phases on that sequence is going to be a function of guidance we get from the feds with respect to the availability of the vaccine itself. The current rollout, we get a few days' notice about how much and when for the next shipment on the stuff that's not related to long-term care. The long-term care stuff, as I said, runs through a distribution model that is primarily focused in this region on CVS and Walgreens. But for the rest of that stuff that I was talking about, the speed with which it will happen is going to be very much a function of how fast the vaccine actually gets distributed by the feds and how much lead time they can give us with respect to when the next set of doses is going to show up. Right now, we're basically hearing the window associated with, you know, sort of the next arrival is a few days. We'd love to see it be a little longer than that so we could plan a little farther down the road.
You get a few days' notice, a phone call on a Wednesday that's going to show up on a Friday.
Yeah.
Okay.
Governor, how far down the prioritization list can you get with the doses that you have on hand now?
We can certainly work our way through most of the healthcare stuff. And again, the long-term care piece is going through a different distribution model, so you shouldn't really, I don't think about that one quite the same way I think about the healthcare piece. But our primary focus at this point are the healthcare workers, and we're in pretty good shape on that one.
And that would cover all 45,000 first responders as well?
Oh, yeah, yeah. Good question. thanks for the follow-up.
Is there a concern about the variant being detected in New York coming to Mass, and could that shift our rollout of the vaccination process?
I think most of us at this point, while departments of public health are sending data and information to the CDC so that the CDC can determine where the new variant associated with COVID is located, I think most of us are working on the assumption that it's here. I mean, there'd be no reason not to, given the contagious nature of this new variant. I think what I would say with respect to the vaccine rollout is if you were to talk to most of the states, you know, our view would be sooner the better, right? Give us kind of, you know, 6 weeks worth of what the distribution is going to look like, how many, and on what days, and we'll put the infrastructure in place to make sure that we deliver as quickly as we possibly can. But I think the one thing I would say about the new variant, which is deemed to be absolutely treatable by the vaccines that have currently been approved by the feds, is its contagiousness. I mean, COVID was contagious to begin with. The new variant is considered to be far more contagious than the original COVID. And what that says to me is, I'm back to my little speech about how important it is for people to wear masks, maintain distance, and recognize and appreciate that when you're not with the people you live with, you really ought to be very vigilant and careful and cautious about your physical engagement with other people. If you go to the supermarket, you should wear a mask and maintain distance. We have a 25% capacity rule on basically everybody who's not in the healthcare space at this point in Massachusetts. Try to avoid those informal gatherings where people historically got together and piled into a family room or a living room to watch a football game or a hockey game or a basketball game. Take seriously this idea that we were already dealing with a very contagious virus in the first place, which we now have a new variant that's even more contagious than the original one. So everything we can do to be vigilant about this is going to protect you and the members of your family from getting the virus or potentially giving it to somebody else.
Last question.
Governor, the climate bill went to your desk yesterday. Do you plan to sign that or?
I think the Lieutenant Governor and I are probably going to look at it before we make a decision about what to do about it. Obviously, there are a lot of elements to that bill, we'll be reporting back on that sometime in the next 10 days.
This could be for you or Dr. Kerouac. Obviously, there are two options for the vaccine right now. More will probably be coming in
Yep.
weeks or months. I'm getting a lot of people telling me that they have the choice of which one they want to get, but they're hesitant of which one to get. What would you say to them, people who are hesitant of getting the vaccine because they don't know which one to choose?
Well, I'm definitely going to let him answer that one. My view would be I get a flu shot. I have absolutely no idea who manufactures the flu shot. To me, there are federal guidelines this is operating under. To me, the issue here is these things were both developed, the two that we have were both developed on kind of more or less the same platform too, but I'll let a doctor speak to that.
Yeah, it's a coin flip. They're equally effective. Side effect profile is similar. I really wouldn't get hung up about that. I'd be thrilled to have a third or fourth one in the pipeline as well. It'd speed up the whole process.
We do have two more. You know, AstraZeneca was approved by the UK. Hopefully at some point they'll finish their trial process and their clinical review here in the US. J&J, Johnson & Johnson, has a very big, they're in the midst of a very big phase 3 clinical trial. I think they have 60,000 people in it. And by the way, there are a bunch of hospitals in Massachusetts that are participating in that trial as well. And obviously it would be nice to have, as Dr. Kerouac said, it'd be great to have a couple more vaccines available as part of the universe. But from my point of view, 94, 95% effectiveness, I think people should be perfectly happy with either one. Thanks again to the folks here at Bay State for all you've been doing.